Thank you so much for all your inputs, doctor. It was very informational and very awareness creating thoughts. Like it did create certain awareness within myself. Thank you so much for that. Moving on to the final question: how valvular heart disease are risk to mother who are pregnant and to the baby? Let it be an early stage of pregnancy, or as when the mother is pregnant for like 8 months, the baby is it's a newborn baby. What are the real risk factors, doctor?
If a woman is suffering from some valvular heart disease, we know that we are living in a country which has a very high prevalence of the valvular heart disease in young population. Young population is having uh, very high frequency of the rheumatic heart disease, which is a valvular heart disease involving valves of the different part of the heart. So if a female of the age of 8 to 10 years is having rheumatic fever or rheumatic heart disease, she is going to get married at the age of 20-25 years, and she is having underlying heart valvular heart disease which is not known to his family or herself also. She is not aware of the disease because minor exertional dyspnea or exertional fatigue is there. She is yet to be diagnosed with the valvular heart disease, but because we know the disease is there in our country, and many of the young female is suffering from rheumatic heart disease, that is valvular heart disease of the rheumatic origin in our country, which is not being diagnosed. These girls marries, and once they marry, they become pregnant, and they are pregnant with the valvular heart disease. This is a big one of the very common scenario which we face in a clinic, where a young female comes with the first pregnancy. She is married 1 year or 2 year back and now comes with a pregnancy, and when we examine we find there is a valve damage. These are the very situation which is very traumatic for the family, for the girl and the doctors also, and it's a medically challenging also to decide whether to continue with the baby or not. So any prospective mother or anyone is having some symptoms, because symptoms are very subtle. If she is having any symptoms of recurrent palpitation, that is fast heart rate, she is having swelling of the feet or joints, or she is feeling dyspneic while going upstairs, becomes very fatigued very easily, these symptoms are there, she must be evaluated for any cardiac illness, particularly valvular heart disease. Once she is diagnosed with the valvular heart disease, and if she is planning for pregnancy, she must consult cardiology so that a treatment of valve disease is optimized, and pregnancy should be planned pregnancy in these cases rather than a accidentally or a unplanned pregnancy, because you have to look for the health of the mother. At the same time, you have to plan for the good outcome of the pregnancy. So pregnancy with valvular disease is actually very important area where we must spread information in the general population so that they do not face a situation where the pregnancy is already progressed for 3 months or 6 months, and now the mother is having severe exertional dyspnea or a dyspnea at rest, and she's having swelling of the feet, and the lung is congested, because mortality is very high in this situation. So screening for a young female with subtle symptoms of the valvular heart disease is must for valvular heart disease. Once the diagnosis is there, the appropriate treatment must be started. And also, if somehow she became pregnant and unknowingly, and she was having underlying valvular disease, the treatment must be started, because mother's health is a priority. Next priority is the baby's health, because if you're losing mother for baby, that is also not good. So decision to continue pregnancy must be made early in the pregnancy if patient is having valvular heart disease, so that we can save mother. If it is not possible to do anything, we must care these mothers in a specialized center where delivery is possible with the cardiac and obstetric and all those cares are there. So all young female which is going to be married or even not married going to be in an age or reproductive age that is going to be 15 years, 16 years now, and next 10 years she uh, get married, or she must be, if she is having any symptom, must be screened, because consequences of pregnancy with valvular is very high. What are the, if somebody is suffering from the valvular heart disease, and at the same time there is also most of the valvular heart disease which is there in young population, they also have a problem of a fast heart rate that is called atrial fibrillation. So in this situation we must make blood thinner by giving anticoagulation. So if somebody is suffering from valvular heart disease, if she is planning to have baby, she must get optimized for these blood thinners, that is anticoagulants, because in pregnancy we give different type of anticoagulants, and in non-pregnant state we give different type of drug for making the blood thinner. So these are the things she must be aware. And if the whole pregnancy is not planned properly, this will definitely lead to a catastrophic outcome. Many patient with a small valve, stenotic valve, become pregnant. If nothing is possible, if it is not possible to terminate the pregnancy, we must intervene at the certain timing in the during the pregnancy to open the valve in the cath lab. There are procedures and maneuvers where we can save these mother and baby also both. There are mother with a dilated cardiomyopathy, the valve region become pregnant. There also we must intervene early so that we can save both mother and baby both. So knowing the valvular heart status of the baby mother beforehand is the best thing. If somehow, if you're not aware of the valve disease and she becomes pregnant and now she came to know that there is some symptom and we find that there is valve disease, the appropriate treatment of the valve disease must be given, keeping in mind the safety of the baby and safety of the mother both. There are procedures which can be done during the pregnancy in a desperate measures. If needed, this must be done, and the care must be under eyes of the cardiologist and gynecologist both, rather than in isolation. If you know the problem is there must be you can say the team approach in these cases, the valve with pregnancy, and utmost care and utmost close follow up of the mother is very important, and close follow up his cardiac condition, his vitals, that is heart rate and other things must be monitored, and if needed the anticoagulation, that is the drug for the making the blood thin, it must be changed or optimized. So these are the precautions in general population must know, that the valve disease with the pregnancy is an entity where there is danger to mother, and beforehand we must know what is going on inside. And if mother is having valvular heart disease, we must appropriately treat the mother and treat both. Thank you.